College Hospital. I'm also a member of the National Task Force for Cervical Cancer Elimination in Nigeria. That's the Federal Ministry of Health and Social Welfare established to drive the agenda of the federal government in our quest to eliminate cervical cancer in the country.
Yes, can you tell us about the causes of cervical
Well,
cancer?
cervical, like I said, cervical cancer is a public health challenge, and our data, national data, show that nearly 13,000, more than 12,000 women are having cervical cancer every year, and almost 8,000 of them die from the disease. And like I said, it's a disease of inequity because in the high income countries, many of them are striving towards eliminating the disease by ensuring that the number of cervical cancer per 100,000 is less than 4. That's when you say a country has eliminated. And Scotland is on that path. However, in Nigeria, it's a disease that is still very common because a lot of our women are not aware about the disease. 80% of women who have cervical cancer present in advanced stage when definitive care is no longer feasible. And another 80% of them do not even have access to care. And what we are learning from research that are done in the country show that less than 10% of them has ever been screened. So because of this inequity, that's why the burden of Nigeria in terms of cervical cancer. Recently, my own research group called HPV Consortium at the College of Medicine, we did a review of the burden of cervical cancer in the whole of West Africa, involving 16 countries. Nigeria alone accounted for nearly half of the burden of cervical cancer in West Africa. So it's a big problem. Now, what is the cause of this cervical cancer? The cause has been linked to a virus called human papillomavirus. This virus we cannot see with our eye, and it is largely transmitted through unprotected sexual intercourse. Now, when this virus is acquired during sexual activity, 80 to 85% of women will clear that virus. However, about 10 to 15% of them will be unable to clear this virus. And this virus will now persist at the neck of the womb that is called the cervix, specifically in a point called transformation zone. Now, if that woman is screened and found to have the virus or found to have an abnormality at that neck of the womb, then that woman can be treated. However, if there is a failure of that screening within that 10 years, what happens? The woman can now develop invasive cervical cancer. So every case of cervical cancer identified is a sign of missed opportunity. That means that woman has missed an opportunity of nearly 10 years. Whereas in those that are immune compromised, such as HIV positive, women who have had organ transplant, women who are on steroid for whatever reason, the interval, what we call the latency period between the time that woman acquired the virus and the development of that cervical cancer can be as short as 5 years. And that is why prevention of cervical cancer is a three-pronged approach. Now, the prevention is that you want to prevent young girls before they reach age of sexual initiation. In Nigeria, which is roughly 16 years, you want to give them a vaccine that will prevent them from acquiring this virus. And that vaccine is called human papillomavirus vaccine. There are about 5 of them that have been licensed. More are coming. But Nigeria has adopted the tetravalent vaccine called Gardasil. Now, Nigerian government, between 2023 till date, through 2 rounds of national vaccination program, vaccinated 12.3 million. That is the largest single vaccination program in the whole world. So that is a success by the government of Nigeria. The second thing that is also primary to prevent, the form of primary prevention, is family life education program. Young girls in the primary school, in early secondary education, should be told about safe sexual practices, because infection with HPV is higher among adolescents and young adults. So because one of their indiscriminate sex, and then of course because of the anatomy of the neck of their womb. So that is the primary prevention. Now, for those that are now sexually experienced or sexually active, they need to be screened. And the best mode of screening advocated by World Health Organization as of today is to use HPV DNA testing. Now, HPV DNA testing is that you take a swab from the neck of the womb, and then you subject it to analysis, and then you see whether the woman has any of the 13 high risk that can cause cervical cancer. And then thereafter, that woman is now subjected to, if she's positive to any of those 13 high risk, she's subjected to further examination, what we call colposcopy or visual inspection with acetic acid, and the abnormal areas are identified and treated by way of either giving thermal ablation or LEEP. Now, for those that have the disease, of course, when you are doing this screening, you will now be picking early disease that are amenable to treatment, and that treatment can be in form of surgery or chemoradiation. Now, what is also important is that people need to understand how this virus is transmitted. Recently, our group in College of Medicine, the HPV Consortium, we did a survey in 2 local governments in Ibadan between 2015 and 2018. That's probably the largest survey after the first study that was done in College of Medicine more than 20 years ago, called the Deacon study. This is called a Shini study, sexual behavior and HPV infection in Nigeria. We did find out that sexually active women in the community, as high as 45% of them are positive to HPV, even though they are healthy. And this survey was done in the community. Now, among sex workers, it is as high as 65%, meaning 1 out of, or nearly 7 out of every 10 sex workers has the virus, whereas 4 out of every 10 women in the community has the virus. Again, it doesn't mean they have cervical cancer, but these are women that needs to be screened to see whether they now have abnormal lesions or not. So it is important that we create awareness. But on the corollary part of it is that as common as this virus is, the awareness and knowledge about it is very low. Studies shows that less than 1 in 5, in fact in some places less than 1 in 10 women has ever heard of a virus called HPV. And that is the sad thing about it. But I must say that with the effort of research and with some of our own group like HPV Consortium in Ibadan, we now have opportunity to kind of provide point of care same day screen and treat for women who wants to take that opportunity. Presently, we're doing a research among women living with HIV/AIDS, where we give them swabs themselves. They get to a corner, take the sample themselves, and then bring this sample out, and they get tested. Within 1.5 hours, they get their result. This is against when a woman comes to the hospital and then they will tell her, oh, you come and do maybe a cytology test that we call pap smear, come in 3 months time, come in 2 months time for your result. I mean, if somebody comes to screen for cancer and he doesn't know whether the result will be positive or not, or negative, we can all imagine what will be going through her mind. But now we now have solutions that they can get their result the same day. They can do the next stage of screening, what we call colposcopy, the same day. They can be treated the same day. And therefore, they know their fate the same day. And this is what we are planning to also domesticate and partner. And on a national scale, I did mention that I'm a member of the National Task Force. The chairman of our task force is the former Minister of Health, Professor Isaac Adewale. And the committee is a 15-member committee drawn from all the 6 geopolitical zones. I'm also a member, and I chair the research and innovation subcommittee of that committee. And we have been given a mandate. And what is the mandate? That we should draw the agenda for the government as we march towards elimination of cervical cancer in Nigeria. And we're also using the 3-pronged approach. We plan to vaccinate 8 million girls between now and 2030, to screen 8 million women in Nigeria between now and 2030, and to manage 60,000 women who have the disease. And we're so lucky, about 48 hours ago, the wife of the president kick-started that advocacy and backing it up with finance by donating 1 billion naira. Now, the committee or the task force is also planning to work with the private sector and international organization to ensure that no woman is left behind. We're also developing communication strategy. We're tackling the issue of stigma. We're tackling the issue of misconception. We're tackling the issue of vaccine hesitancy. And we're also targeting special population, the vulnerable group, who may be disadvantaged and do not have access to treatment. So these are some of the efforts that we are putting on in the country as we march towards cervical cancer elimination.
Thank you very much, sir.